Hello friends, I'm Dr. Sumit. I'm a urologist, andrologist and a kidney transplant surgeon at Sanar International Hospital Gurugram. Today I'm going to talk about one of the very common problems, that is phimosis, the treatment for phimosis, which is circumcision, the myths associated with the procedure, various ways to do that, and the false information that is circulating among various media channels. And I'm just trying to bust them and provide you with real and genuine information regarding the problem and regarding the management of the problem. Now the question that common is asked is, what is circumcision? Circumcision, it means removal of the foreskin of the penis that covers the front part of the penis, which is also called glans penis. Now, second question that often is asked, what are the indications for removal of the foreskin? Now, the indications can be religious. In Jews and Muslims, at birth only, the foreskin of the child is removed. The indication can also be recurrent infection, which is also called recurrent belanoposthitis. Especially among diabetics, this is very common. So if the front of the penis is getting infected again and again, it is better, for the sake of management, to remove the foreskin. Third indication is phimosis. When somebody is unable to retract the foreskin backwards, and one should normally be able to retract the foreskin way beyond the corona, that is the groove which is there between the cap of the penis and the shaft of the penis. One should be able to retract the foreskin beyond it. If someone is not able to do that, then this becomes an indication for circumcision. Sometimes the foreskin is tight, one is able to withdraw it, but it does not come back to its normal position. This condition is called paraphimosis. This also is one of the indications for circumcision. Another question that comes in mind is, are there any advantages associated with this procedure if somebody, even without an indication, undergoes circumcision? If circumcision is done at birth, then it makes the person almost immune to penile cancers. Hence, in Jews and Muslims, the chance of penile cancer is negligible. Circumcision also enables one to maintain a better penile hygiene, because the skin now is always retracted. So therefore it is easy to clean the penis and the chance of infection becomes very less. Sometimes circumcision is also done to increase the endurance of sex. When the circumcision is done, the front part of the penis, which is also called glans, it becomes relatively desensitized, and the man is able to have the act of intercourse for a slightly prolonged duration. So if there are so many advantages associated with the procedure of circumcision, shouldn't everyone undergo it? And the correct answer to do that is no. God has created male anatomy like this for a certain purpose, for a certain reason. So no, it is not necessary for everyone to undergo this procedure. However, even among European nationals, among Americans, people undergo circumcision for cosmetic reasons and for aesthetic reasons, hygienic reasons. So if some wishes to undergo this procedure, it is relatively safe. However, it is not mandatory for everyone to undergo this procedure. Next question that comes to mind is, if I want to undergo circumcision, what is the best way? Whether I should undergo circumcision through a normal conventional route, which involves stitching, or laser circumcision. Another way to do it is ZSR circumcision. So let me break the myth around laser circumcision. Laser is a tool which is used to make a cut. Laser circumcision has no added advantage over a normal circumcision on which we make the cut using a sharp knife. Except maybe blood loss can be a little less. But in any case, in the surgery for circumcision, blood loss is negligible. Hardly 5 to 10 ml of blood is lost, nothing more. So there is no advantage of laser circumcision. So why do people undergo laser circumcision? Why do surgeons do laser circumcision? And the reason for that is there is a glamour associated with the word laser. Since you as patient ask for it, the surgeons and doctors, they offer it. But as such, there is no added advantage of laser circumcision. So my advice to you is don't ask for it, don't spend extra money on getting laser circumcision done. It's absolutely a useless thing to do. Another way to remove the foreskin is a stapler circumcision. It is also known as ZSR circumcision. This procedure involves using an additional stapling device which is used during the surgery, and use of this stapler ensures very good approximation of the tissues after removal of the foreskin. Additionally, the blood loss is almost nil. The stitches are not needed when we use stapler to perform circumcision. So if correctly used, laser circumcision definitely is very beneficial as far as cosmesis goes, blood loss goes, albeit it comes with a slight additional cost. The cost may be 5 to 10,000 rupees extra over and above the normal way to do circumcision. So I hope I have been able to provide you with some information regarding phimosis, regarding circumcision, ways to go about it. And I hope you guys will be wiser when you ask for the procedure of circumcision from any surgeon next time. Thank you.